Individuals over the age of 60, especially those with underlying medical conditions, should really take this seriously.
Words of caution today from Utah's Department of Health as the second confirmed case of COVID-19 is announced today in the state of Utah. The woman just diagnosed with coronavirus had traveled extensively, according to the Utah Health Department.
Yeah, she was tested about a week after she got home and started to show some of those symptoms. We do have team coverage tonight. We begin first off with news specialist Jed Bowl, who is live to tell us what health officials are most concerned about right now. Jed?
Yeah, Mike, both of those individuals diagnosed with coronavirus here in Utah are over the age of 60, and both of those cases were travel related. In other words, they did not catch the virus out in public here in Utah. So state health officials are still waiting to see when the virus will spread from person to person.
The patient is still hospitalized. She is stable and doing well.
Good news so far for the woman at McKay-Dee Hospital in Ogden.
Shortly after her return to Utah from her travels, the patient developed symptoms and sought care.
The woman had traveled extensively in the weeks before she started to show symptoms of a serious respiratory illness, traveling to Florida, the Bahamas, and Nevada. But they don't know specifically where she picked up COVID-19. Not on a cruise ship, but she had taken a boat to the Bahamas.
Individuals over the age of 60, especially those with underlying medical conditions, should really take this seriously and should be extra cautious, especially when doing things like planning travel, attending large group events.
So far, none of the people that she's been in contact with have tested positive for COVID-19. They've identified 3 high-risk individuals who had been in contact with that patient, tested them, and asked them to self-quarantine.
We are expecting to see community transmission and potentially secondary cases from both the first and second case diagnosed here in Utah, but we're thankful that we haven't yet.
For both Utah patients who have tested positive for COVID-19, the Utah Department of Health has done extensive contact tracing.
We go back in time to the beginning of their symptoms and identify everyone they came into close contact with,
including people at events they attended. Health officials tell them they may have been exposed, ask them to self-isolate, and call them daily to assess their symptoms.
We have not identified any community spread of COVID-19, and so the risk to Utahns is still low.
Again, the Utah Department of Health has tested all of those individuals who have had close contact with both of those positive cases here in Utah, and none has tested positive so far. Mike?
All right, Jed Bowl live for us this evening in Salt Lake. Jed, thank you. Deanie?
Utah laboratory ARUP announced today they'll launch a new test for COVID-19 on Thursday. ARUP says they're working to increase their testing capacity to support regional and national testing needs. They say health systems and their hospitals are encouraged to first work with their state laboratory departments to determine their best testing options. But ARUP says as this public health concern has grown, developing a test to detect COVID-19 is a priority for them.